Awesome, everybody. Thank you so much for indulging me and answering that chat question I had. Good day. Hi, Lethelia. That's a beautiful name. Welcome, everybody. We're so excited that you're here. I'm Megan Ockett. We'll do introductions here in a minute, but first I wanted to just do a little bit of housekeeping with you. We'll probably have people come in and out, so you'll see that chat go off. I'd love to know where you're from in the great state of South Carolina and which organization you represent. Like I said earlier, we're from Iowa, so just kind of love learning more about where you guys all are and learn more about the geography and of South Carolina. And so just a couple of housekeeping things. This is being recorded. So Jen, you will get an email from Jen after this today or tomorrow with the recording, with a PDF of the slides, and then just a really short evaluation that we would love for you to fill out. And so that will all be sent to you. So you'll have that. You can share it with team members and everything, anything that you need. Jen and I will turn off our cameras in a moment, just so that you can see our lovely faces for this, but we have a couple videos that we want to share, so it just helps with streaming and everything like that. During the webinar, please feel free to use the chat box for questions. We will answer questions at the end of the webinar, but we really don't want you to lose that. So if you have a question in the middle of a slide and you're like, I want to ask this, I want to write it down right now, we will address it at the end. But I just wanted you to know, go ahead and fill those out, write those in right away so you don't forget them. And maybe we'll answer them as we go. If so, awesome. If not, then we will be sure to answer your questions at the end. So again, I just want to thank you all for being here, and a special thanks to the Children's Trust of South Carolina. It's because of them that we're having this webinar today, that you see those toolkits that we're going to talk about in a little bit. And we're just super excited to be here today. So with that, we'll go ahead and get started. Turn off my camera, maybe. There you go. Okay. All right. So this is us. You just saw us, but just a little bit more about us and who we are. Again, I'm Megan. I'm the program director with Healthy Birthday, Inc. So Healthy Birthday, Inc. is the nonprofit organization that created Count the Kicks, which is the stillbirth prevention campaign that we're going to be talking about today, that you're going to learn all about. A little bit about me and my experience. I have around 11, 12 years of experience in public health. I'm really passionate about maternal and child health. I really do believe in empowerment and prevention. And I work hard to educate on the importance of tracking fetal movement in the third trimester and to speak up if there's a concern. So part of my role within the organization is to work with our partners like the Children's Trust and all of you here to ensure that you all have the tools and resources that you need to bring the successful campaign of Count the Kicks to your community, and to ensure our technology, our app, which we'll talk about in a little bit, is user-friendly and inclusive. So I'm super excited to be here today, and I'll throw it over to Jen.
Thanks so much, Megan. Yeah, my name is Jen Rowry, and I am the Associate Director of Engagement for Healthy Birthday. It's kind of a fancy way of saying that I engage volunteers, especially our high-level volunteers, our ambassadors. We have 42 across the nation that we'll talk about later in this presentation. I also engage relationships, community-based organizations, or other partners in just sharing the spreading of Count the Kicks and awareness. My background, just a little bit about me, is in education. And really, I came to know of this great organization, and it's a very important life-saving cause because I'm neighbors with one of the founding moms, Carrie Biondi Moreland. And you'll learn more about this organization and its mission, but it was founded out of loss by 5 Iowa women. So we are so excited to get started and share more.
Awesome. Thanks, Jen. So one of the first things we love to do is we love to share this Good Morning America video with you all. We share it for a couple reasons. One, it's just a feel-good video. It's surely going to bring a smile to your face. If you're not familiar with Count the Kicks, this does a pretty good job of giving you a quick overview to really set the stage for the rest of the presentation. We also show this to you because we may reference a couple of the statements that this mom does in the video later on in the presentation. I also want to share that this video aired in 2017 when baby Ruby was saved when her mom noticed reduced fetal movement. This took place right here in Iowa. We held a press conference sharing Ruby's story, and it was quickly picked up by national media. And due to this, we saw a huge spike in our app downloads. We also know the importance of that mom-to-mom storytelling. This is case in point. So anytime you can share one of our baby safe stories or a video like this to any of the expectant parents you work with, please do so, because this will resonate with people. This will resonate with the expectant parents you're working with, because you never know who will hear something like this, who needs to hear it, and then potentially save their own baby's life. So let's go ahead and watch.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Awesome. Thank you. So I know that was a little delayed, but we will send the direct link to that in the email, so you can just have that easily available to you. So let's talk about how we hope to save more babies together, especially in South Carolina. So we have a highly effective evidence-based stillbirth prevention campaign, and we have developed an early warning system for moms, expectant parents, and we're saving 1 in 3 at-risk babies in Iowa. Our campaign's ready to go, and we're so excited to save more South Carolina babies with your help and the help from the Children's Trust of South Carolina and the Department of Health and Environmental Control. And if you just joined us, you should have joined us on mute, but if you're not, would you go ahead just mute yourself? We'd really appreciate it. Go ahead and ask questions in the chat box as we go. We'll be sure to answer those at the end of the webinar. Go ahead, Jen.
Yeah. Well, it's important that we all have the same definition of and understanding of the prevalence of stillbirth in the United States. So let's just take a minute to talk about these important details. Stillbirth is defined as a loss of a baby after 20 weeks of pregnancy. That's the definition we use in the United States. That is not necessarily the definition that every country around the world uses. Stillbirth is further classified as either early, late, or term. An early stillbirth is a fetal death occurring between 20 and 27 completed weeks of pregnancy. Late is a 28 to 36 weeks of completed pregnancy, and a term stillbirth occurs between 37 or more completed pregnancy weeks. And we know that the risk of stillbirth actually increases closer to the end of a woman's pregnancy. On an average, we lose 23,500 babies in the United States every year to stillbirth. Let me say that again. We lose 23,500 babies to stillbirth every year in the United States. However, we don't talk enough about this, and there's still a stigma around stillbirth and a lack of education around stillbirth. So one of the missions of our campaign is to change that. Just in comparison, a miscarriage is usually defined as a loss of a baby before the 20th week of pregnancy. And infant mortality is the loss of an infant that takes their first breath through their first birthday. On an average, sadly, we lose 22,000 infants each year in the United States. But as we look at that, we definitely want infant mortality addressed. But we want to also have a conversation about stillbirth. And these statistics are shown in the link there from the CDC that you'll get when you receive these. So if you're really into data, when you receive these slides, you're welcome to click these live links. The likely causes of and contributors of stillbirth are identified by the study link here at the bottom of the slide and are listed below in order from most common to least common. So why are we losing babies in the United States? According to this study, pregnancy and labor complications, problems with the placenta, birth defects, infection, problems with the umbilical cord, and medical complications in the mother are all ways or reasons we lose babies in the United States. It's also important to note that a significant percentage of stillbirths in the United States still have unknown causes.
So like Jen said, this is a significant issue and it's rarely talked about. And that's what we're here today to do, is we're here to give you the tools and resources to feel more comfortable talking about it, to share it with your expectant parents, and to just become more familiar with it. And so when we talk about the data, when she talks about that 23,500, that's basically 65 babies a day. So a school bus full of children is a comparison to that. So it's a lot more prevalent than people think about. It's 1 in 169 pregnancies will end in stillbirth, and the racial disparities are large. For Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times, depending on the state, more likely to have a stillbirth over their white counterpart. Hispanic moms, it's 1 in 199. Indigenous moms, 1 in 138. White women is 1 in 204, and Asian Pacific Islanders is 1 in 233. So like Jen said, it's just as prevalent, slightly higher than infant mortality. Families are 10 times more likely to lose a baby to stillbirth than they are to SIDS. So now that we looked at national data, let's look at your data. So specifically in South Carolina. So all of this data, you can see the citations there, comes from CDC Wonder from 2019. And then the Iowa stillbirth data that we'll talk about too comes from Iowa Vital Statistics from the Iowa Department of Public Health. But your stillbirth rate for the 5-year average is 6.84 per 1,000 live births. So unfortunately, South Carolina is in the top 10 for highest stillbirth rates across the nation. The national average is 5.96. So 1 out of 130 pregnancies in South Carolina will end in stillbirth. South Carolina loses approximately 395 babies to stillbirth each year. In Iowa, we're going to talk about this on the next slide, but we've seen a 32% reduction in the number of stillbirths. So that's why we talk about that 1 in 3 at-risk babies. So if we put that towards your numbers, we have the potential to save 136 babies from preventable stillbirth in South Carolina. So this is the data for Iowa that we just briefly want to touch on, because this is what we want to see in every state and more decrease in every state. So our goal is to save 7,500 babies across the nation. If you look at this chart, and I know it's kind of small to see, but you can see that red line is that national average, and the blue dots are Iowa stillbirth rates per year. And then that dotted line is our trend data. So you can see 2008 was actually when Count the Kicks was created by those 5 women that Jen had talked about. And then you can see we've had a steady decline. So if you actually do the math, it's a 32% reduction in the 10 years of the inception of Count the Kicks, and we continue to decrease. There are time periods like those years in 2017 and 2019 where we do see a spike, This is why we look at averages a lot. We look at 3 and 5 year averages. Things like a syphilis outbreak, a pandemic, things like that can exacerbate that and cause those spikes. So looking just at the trend overall, we do have that decrease. In the first 5 years of the campaign, we saw a decrease among African-American women by about 39%. And so again, we're just super thankful to the Children's Trust of South Carolina to be able to share this with you so that we can start hopefully seeing these decreases in your state as well.
Thanks, Megan. Yeah, as mentioned by Megan on the previous slide, there is a large divide when it comes to those who are more likely to experience stillbirth. And I want to just take a moment to share that what research has shown to be some contributing factors to these unacceptable disparities. Please note that Healthy Birthday Inc. has reviewed research articles, and these points come from various articles that we would be happy to share with you if you're interested. So let's just take a minute to talk about these factors. Systemic racism, epigenetics. Essentially, your genes play an important role in your health, but so do your behaviors and environment, such as what you eat and how physically active you are. Epigenetics is the study of how your behaviors and the environment can cause changes that affect the way your genes work. Unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they can change how your body reads a DNA sequence, thus impacting your health. Many of these conditions, Black women are predestined to, or other races have certainly issues that they're predestined to have, like that are contributing factors to stillbirth, like gestational diabetes, preeclampsia, and high blood pressure, which honestly are all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. And we also see toxic stress up there at the top that I accidentally skipped over, so I apologize, but that is that epigenetics, that predisposition that can be contributing factors. Access to healthcare, socioeconomic barriers. One thing we want to note is that research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So what is Count the Kicks doing to reduce these disparities in stillbirth? We take this very seriously. We have a wonderful health equity coordinator on staff, Ms. Stephanie Moody, who's always helping us to find opportunities and to, quite honestly, keep our focus where it needs to be. We're looking for funding opportunities. We are an inclusive organization with 100% board and staff training on anti-oppression and structural racism. We improve programming based on lived experiences of women of color. We are in the communities. We are reaching out to marginalized communities. We are holding focus groups, whatever it takes to learn more. Community-based organizations that are already serving and entrusted within a community are great types of organizations that we can partner with to reach those marginalized communities. Our app is in 12 languages, and we're going to talk a lot more about our app later, but that also reaches a larger audience. We have culturally appropriate educational materials, and we have videos and printed educational materials and FAQs in multiple languages. And you can find those. We have a YouTube page, but we also have a great website, www.counttthekicks.org, houses these videos and many, many resources, including the FAQs, and again, in multiple languages. So we have a great partner here in the Des Moines area, Brianne Ward. And we're just going to play this video of Brianne. She has worked closely with our staff, not only on our trainings, our anti-oppression and implicit bias trainings, but also she's done a full review of our organization, from hiring practices to our website and social media channels and beyond. And so let's listen to what Brianne has to say about these disparities.
Did you know Black women are 2 times more likely to lose their baby in the final weeks of pregnancy than their white neighbor, colleague, or friend? It's true. For Black women, 1 out of every 96 pregnancies will end in stillbirth. As a mom and mental health counselor, these statistics are beyond troubling. They're unacceptable. At Count the Kicks, we've developed a free, evidence-based tool to help you monitor your baby's well-being in the 3rd trimester of pregnancy. The Count the Kicks app is saving lives. Here's why it matters. Studies show babies move less when they aren't doing well. Just like when adults feel sick, we want to lay in the bed or on the couch. It's the same with babies. If they are struggling, their movement changes. A decrease or rapid increase in movement is the earliest and sometimes only indication that there might be an issue with your pregnancy. The Count the Kicks app is a powerful stillbirth prevention resource, allowing moms to have a daily kick counting session to get to know what's normal for their baby. You can even share your kick counting information with your partner or friend. If you notice a change in what's normal for your baby, we encourage you to speak up to your provider. Don't wait. Hospitals are open 24/7, ready to serve you. We want you to have the joyous birth experience you deserve. Download the free Count the Kicks app today. Did you know?
Great. And so like I said earlier, we'll be sure to send those direct links in the email that will go out after. So let's take a couple minutes, and I just want to talk about the research and evidence, because this is an evidence-based research-backed campaign. And I think it's really important to know kind of the history of it and some of the evidence towards the importance of tracking fetal movement. So what you see on your screen is the research article that started it all. This was written by several researchers. Dr. Ruth Fretz there is circled. She's also on our medical advisory board now. But the reason I highlight this research article, because if you only read one out of all the ones that we've talked about, out of all the ones on our website, this is the one I want you to read. This is the one that started it all. So Jen has mentioned a couple times that our founders were our 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. And they actually didn't know each other at the time of their loss, but they got connected through pastors and friends. And as they started connecting and meeting over coffee to grieve together and started realizing that this is a lot more common than people think. I mean, look at them. Here were 5 Central Iowa women who all experienced relatively the same thing within a short amount of time period. And so fast forward a couple of years, long story short, one of the things that they did was they worked with Senator Tom Harkin at the time to create the first stillbirth registry in the nation. So a place to collect data that would help find out trends in stillbirths. It was because of this funding from CDC and the stillbirth registry that some of the founders were able to go to a conference on stillbirth and talk about their findings and talk about this stillbirth registry. So while they were at this conference, they were listening to some other presentations, and there was one that really stood out, and it was one by Dr. Ruth Fretz, who was talking about this research study that she participated on in Norway. And so within this study in Norway, this public health research study, they were working with expectant parents and educating them on the importance of tracking fetal movement in the 3rd trimester of pregnancy. And within this cohort of pregnant women, they saw about a 30% reduction in the number of stillbirths within this cohort, just by educating about this non-invasive way to track fetal movement. And so the founders heard this and they said, that is amazing. Like, we need this. We need to bring this back to Iowa, and we need to create a campaign about it. Kick counting's been around for a while, but the tools and resources and the talking points and all of the pieces that we have, that's new, and that's what they created. So they came back to Iowa and they said, we can do this. Great things are happening and created in Iowa. So they worked with Iowa Department of Public Health and a local marketing company here to create what we know and what you know as Count the Kicks today. So that bright, that colorful, that empowering movement, because the founders thought if we could save one family from this terrible tragedy, if we could save one baby, then that would be amazing. And here we are over 10 years later, saving who knows how many babies and decreasing the stillbirth rate, all because of this idea, and I love this quote from Dr. Ruth Fretz, where she says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And so that normal movement pattern is something you'll hear a lot through the rest of the presentation. And that's the big takeaway that we'll talk about here in a minute. So let's talk about a couple other evidence and research behind the campaign. So in January 2021, we were named a best practice by the Association of Maternal Child Health Programs, or AMCHIP. They have a scientific review board and determined that our program engages stakeholders at all levels of practice. Ensuring improving health equity is an integral component to our overall program sustainability. You heard Jen mention that earlier. And so we do have these positive results. So I just wanted to mention that about AMCHIP. And then if you also look at the CDC Hear Her campaign to reduce maternal mortality in the United States, the CDC lists 15 urgent warning signs for pregnant women, and the importance of paying attention to babies' movements is one of the key markers. And then let's quickly talk about something that you might be thinking, this is just going to increase anxiety. I don't want to share this. And I'm here to tell you that's not the case. Jen is here to tell you that's not the case. One potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually fetal movement count is reassuring to the pregnant woman and prevents unnecessary visits. And the reason that is because you have now educated, highly informed, expectant parents that understand what's normal for their baby. And with our app and our tools, they have data at their fingertips to say, this is normal or this isn't normal and I need to speak up. We also recently have done our own study with Des Moines University and the Harkin Institute. And some of the findings that I wanted to share was that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. The researchers of this study also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. And so that's the big takeaway here, is that when you're talking to your expectant parents, it helps them bond. They can include the whole family. If they have other children, they can say, okay, it's time to count baby brother or sister's movements now. So another thing that I wanted to stress is that this has other benefits that maybe people don't think about. It has, could show reduction of preterm birth rate. Fetal growth restrictions are identified earlier. If you think about it, when we understand what's going on with our body and what's normal for our baby, and we speak up, it's not like right away they have to go in and deliver a baby. No, the provider does the necessary testing on mom and baby to see what's going on. And maybe it's something like baby's trying to be born early, and they can help prevent that and get baby here full term. So there's lots of different benefits for doing this, for being aware of what's normal for your baby and speaking up. And so one takeaway here is women who have had stillbirths are at substantially higher risk of severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So not only do we have the potential of saving those babies, but also the lives of mothers. If we can prevent a stillbirth, we can potentially prevent maternal morbidity and mortality. So I love this quote where it says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So I went pretty quickly through that, but I wanted to just kind of give you a starting point. We have a whole webpage dedicated to research and evidence. And so if this is your thing and you love reading about this, go check out our website and the evidence page, and you can read all of these articles and more. But again, I want to turn it over to Jen so we can really get into the meat of this presentation about really how you implement this, like how do you use the app? So take it away, Jen.
Thanks, Megan, for informing us about why it's important and about stillbirth. But let's talk about what we do. Count the Kicks. Let's really dive in. What is it? It is a stillbirth prevention public health campaign It is, as we mentioned, evidence-based, and it is highly mom-focused, right down to being appealing and not being medically, it's straightforward, it's easy to understand, it's attractive to a non-medical individual like a mom. So those materials are very mom-focused. It educates women, and education is, like I said, my background. And we know that education is an important part of giving a voice to people and empowering them. And it not only gives them a voice, but it helps to give them the information they need when tracking their baby's movement. We can do that both with our free Hallmark tool, the Count the Kicks app, but we also have paper kick counting charts in multiple languages that can be downloaded from our website for those moms that maybe don't have access to mobile technology. And again, it is a message of empowerment. So let's talk about the app since it's been brought up several times. I'm excited to share this tool with you. I think it does a lot of things really well. First of all, it is evidence-based. We have made adaptations to the app and to the campaign as research and evidence comes in on stillbirth. And we have created this app in currently 12 languages, which are listed there. I won't read them, but it does reach a larger audience. And we hope to continue to add languages as needed. And so if you ever feel like there's a language that's missing, let us know. It is available for Apple and Android products. Users can restart their session or delete a kick, which is really important. Mom said to us, darn, I accidentally hit the footprint and I couldn't go back and it skewed my data. So we listened to their feedback because we think it's very important. And we created that restart a session, set a daily reminder. Life's busy. And so everybody can benefit from that reminder. And so we have a daily reminder in the app. And we also can allow users to review kick counting history. They can download their history to share, like Megan, with their provider, family, or friends via text or email. You can count for twins, track future pregnancies on the same profile, and manage multiple devices registered to your account. So just lots of features, and you're kind of seeing some images here. On the right, you can see the image that shows the graph that gets created over time and the footprint that's clicked that starts the timer for learning your baby's normal to get to 10 kicks. And finally, last but not least on this slide, we're excited. We just launched this feature this summer. You can now use an Apple smartwatch to count your kicks. And as a tester of that feature, I thought it was extremely helpful and handy to not have to hold a phone and do your kick counting session. So let's talk about strength. I think this, when Megan showed us the Good Morning America video on Baby Save Ruby, if we think back to what Mom Emily Ecoff said, she said, not only did the number of movements, like there was a decrease in movement, she said, but how they felt, the strength of movement. She said it felt softer or more subtle. Research is actually indicating, and we took again the evidence that we were receiving and turned it into a feature in the app. We know that strength can also be a sign that baby's in distress. Maybe they're getting tangled in a cord, so they're not able to move as well, or maybe they're just not feeling well. When you and I don't feel well, we go to the couch, we rest, we slow down. So do babies. When baby isn't, or when I've had the flu, I think about how weak I feel and how just going up a flight of stairs can be exhausting. My strength is impacted. And so I think that babies are a very way. So this strength feature is really cool. So after a kick counting session, mom can go or will get a cue to rate the strength of her baby's movement. Fluttery being that light, subtle, just almost like it when you first started noticing movements, just kind of butterfly like movements. And then it goes all the way to the strongest movement, which is fierce, strong movement. And over time, just like you see on the very far right example, you see the chart of movement and a change in movement. If we were to see a spike like that, we would want them to speak up. The same thing happens with strength of movement. So if mom notices over time a decrease in strength or a drastic decrease in the strength of movement, she also is educated to speak up. And so this is a great feature that has been added to our app. So here's a short video showing how easy it is to use the Count the Kicks app. So I'm just going to play that for you.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
Yeah, so as you can see, the app is easy to use and it is empowering, and it gives moms the data they need and the encouragement to speak up. So let's talk now about how to implement Count the Kicks either in your, your visits with moms, your clinic setting, whatever the setting is. It's an easy, effective program. So let's start with talking about stillbirth. We know and understand talking about stillbirth is not something anyone wants to do, but it's so important. We don't want to talk to women about breast cancer either, but that doesn't mean we don't educate them to have mammograms. We talk to expectant women about so many things, and we do so many tests, including checking for gestational diabetes or the need for folic acid, or don't change the cat litter. We talk to them about so many risks, and we measure so many risks in pregnancies. It's really important that we don't not educate moms on the importance of tracking movement and stillbirth prevention, and that stillbirth is a reality in our country to address. And so I don't want to scare moms is not a good reason to not have the conversation. It's just another way to educate and thus empower an expectant parent. Stillbirth just happens. There's nothing we can do. Actually, stillbirth can be preventable. There is something we can do. And actually, fetal movement is one of the first and sometimes only warning signs that there's something wrong with the pregnancy and that mom needs to know to look for that. And we don't want to take that knowledge away from her. It does speak up. Her baby is always active. It's not a concern. The reality is babies are active until they aren't. And if you don't have that baseline to know what's normal for your baby, you may not notice the baby's not moving until the baby is been silent for way too long. Cord and placental accidents can be sudden, and moms need to know what's normal so they can notice a change. She's almost at her due date. The risk of stillbirth actually increases. I mentioned this earlier when sharing the stillbirth definitions and data. Term stillbirth is the 37-week and beyond in pregnancy. That actually is a time of more opportunity or risk for stillbirth. And so we want to make sure that we recognize that and that we not get too comfortable as a mom nears her due date. The other thing I'd like to mention that's not like listed as a bullet point, but this isn't just for high-risk moms. And so it's important that every mom, not just high-risk moms, have access to this We know in our work that we come across a lot of moms who were on their 4th pregnancy, everything was normal, there were no risk factors, and yet their pregnancy ended in stillbirth. Speaking of those moms that have suffered previous loss, these conversations are extremely important to have. And we just want to talk about some ways to do that. First of all, follow the same protocol. Make sure that you don't hesitate to have the conversation, that you actually meet that conversation with that mom, but with extra sensitivity. So we want to have the conversation, but we want to make sure that moms that are high risk know to start counting their kicks at 26 weeks instead of 28 weeks, just establishing that baseline a little bit earlier. We want you to talk about that previous stillbirth and acknowledge the child that was lost. That child is their family member, a loved one. They didn't disappear from their memory or their hearts. And so it's important that we not act like that is what has happened. And we know that you do a great job of having conversations with mom. And so please, almost every mom I've ever talked to is more than happy to talk about the baby that she's lost. Be gentle, stay away from terms like fetal demise, show that empathy. Ask if anyone has talked about the importance of tracking fetal movement before. A lot of moms we talked to that have had a previous birth stated they were never told about the importance of tracking fetal movement. And that is something they so wish somebody would have taken the time to do for them. So talking about count the kicks, how and when do you do that? We want you to, this is a great time, by the way. That app is in Apple Play and the Google Store. This is a great time where you're going to get that rare invitation to go ahead and pull out your phone and download the free app now, learn about it. If you ever have questions, please reach out, but it is an easy tool. So if you have a phone and you haven't already, please do download that free app. Talking about count the kicks, I mentioned this on the last slide, but 26 weeks if they're high risk, 28 weeks, so that first appointment in their 3rd trimester is when we want you to talk about count the kicks, and we want you to teach them about learning their baby's normal. We don't want to set a limit or a time on that. We want to make sure that we're talking about their baby's normal to get to 10 movements, learning that pattern and speaking up if they notice a change. How? We want to ask open-ended questions. I think this is really important. In a yes, no questions may not lead a mom to have a conversation that's important to have. And so how we address this and talk about it also is a flag to mom about the importance of talking about it, the importance of tracking it, the importance of this dialogue. And so open-ended questions like, tell me what you know about the importance of tracking your baby's movements, learn where their knowledge base is, and then take the conversation from there. And then you can say, let's talk about how to track your baby's movements. Count each day, learn your normal, speak up. Share that movements are jabs, rolls, and push-ups, anything but hiccups. Hiccups are an involuntary and should not be measured by mom as a fetal movement. So educating her about that is really important. Share the app, which I've asked you to download, if not now, but after this conversation, if you need to, although I'd love to have you do it now, and learn how to use it so that you can show it to mom right there in that clinical setting or in that home setting. You can teach them, educate them, and get them well on their way to taking care of their health and their baby's health. This helpful tip says if you have a patient in a glucose test waiting, this is a perfect time to ask them to download the app so that they can learn about it and get ready to utilize it in that 3rd trimester or 26th week if they're high risk. So Megan and I are going to talk about some common myths. And I'm actually going to role play as though I'm the mom, and Megan is going to role play as though she's the home visitor or the nurse. And so these are some really important myths. And honestly, some of these myths are myths that I believed as an expectant parent. So let's talk about this so we can make sure that we have the right education. My baby is always active, so I don't need to count kicks.
Hi, Jen. Thanks so much for the question. So just so you know, even active babies can experience distress and sometimes quickly and without other warning signs. So I really want you to be tracking your baby's movement every day around the same time every day to really take that guesswork out of knowing if your normally active baby has slowed down. This app, the Count the Kicks, gives you real data to show your healthcare provider if you have a concern.
So I'm not in a high risk pregnancy, so I don't think I should count my kicks.
I understand that feeling, but it's really important that every expectant woman should be educated and talk about, or sorry, I'm not role playing, am I? Should be educated and download the app and get to know what's normal for your baby, whether you're high risk or not.
So I've heard that I only need to get 10 kicks in 2 hours.
Right. So every baby is different. And what we really want you to do is to understand what's normal for your baby and to not put that time limit on it. That's actually outdated. And what I really want to share with you is that you need to understand what's normal, the normal amount of time it takes a day, each day for your baby to get to those 10 movements. So then you can notice if there's a significant change in those movements, you can speak up. And I'll just add really quick here, there's a research study on this on our website, but the reason this is outdated and not current anymore is because that it's exactly that with the 2 hours with that time limit, because what was happening, what these researchers were finding was when you put that time limit on it, that's what we focus on as humans, right? So let's say you have somebody counting and they routinely get around 15, 16, 20 minutes every day. And one time they're counting and they get 10 movements in an hour and 45 minutes. That's a significant change from when they were normally getting 10 movements around, 15, 20 minutes. They were now getting it an hour and 45 minutes. This is just an example, of course. But to them, they think, well, my doctor said 10 and 2, so I got it all within 2 hours, so I'm totally fine. But that is not their baby's normal movement. So that's why I think that's a better way to explain it that way. But again, that research article is on our website as well. Go ahead, Jen.
Sure. So I can just check on my baby using a Doppler device instead of kick counting.
Okay. I really don't want you using a Doppler device. I know there's apps out there. I know unless you're medically trained, I don't want you to use a Doppler device because a change of the baby's heartbeat is one of the last things that occurs when your baby's in distress, whereas a change in movement may indicate potential problems before the heart rate. Plus, it's very difficult to determine what is your baby's heartbeat and what your own heartbeat is. So unless you're medically trained, please do not use a Doppler device.
So when my baby's not moving, I just go and take eat a sugary snack or drink cold water or juice.
I really don't want you to do any other interventions like juice or candy to try to get baby moving, because if baby isn't moving like normal, you need to speak up right away. We don't want to make it so baby has to move because they're whatever hyped up, and really research has said, that's not what we want. And so if you notice baby's not moving like normal, instead of trying to force baby to move, go ahead and call your provider.
So I was told that babies actually kick less near the end of pregnancy.
Your baby is not running out of room at the end of pregnancy, but your movements may feel differently. So you might have less of those huge rolls where you could see, that whole belly move and more of those jabs. But really, babies are moving up to and even during labor. And so if you're monitoring your movements every day around the same time, it should still take around the same time to feel those 10 movements.
So, and maybe less role playing here, but one of the myths is that triage doesn't need, labor and delivery triage does not need any Count the Kicks education.
Right. So if you're on here and you work with labor and delivery triage, or the contacts, or you work there if you're a nurse, that's really one of the perfect places to have this information. The posters, the brochures, discharge papers, all should be used when someone comes in for anything, whether it's bleeding, contractions. If I went to triage several times with my daughter for various reasons and everything got checked out fine, that would be the perfect time to say, hey, remember to count those kicks. Here's an app. Here's the brochure. read it while I get your discharge papers, and then let me know if you have any questions. So feel free to share this far and wide in your community is really important. So other ways to integrate, one thing Jen and I did not tell you was we're kind of like fans about systems change. And anytime we can help you determine a way to integrate Count the Kicks, the talking of fetal movement monitoring into your system, into your workflow, we want to talk to you about it. So here are a couple ways that have worked for other organizations. I want you to begin thinking of what could we do here? What could we do with my organization to really make this impactful and really make this second nature? So we don't have to think, I got to pull out the Count the Kicks brochure, you know, so what are some things? So you could use a form. We have a couple samples that we'll show you here in a minute, but if you do intakes, if you do checkpoints with your families, if you have somebody that comes in and they check in every time, like have your front desk staff trained on this and have them, you know, if it's marked that they're pregnant and they're 12 weeks pregnant, is there a form or something on your system that you can flag? So when they come back in and they're around 26, 27 weeks pregnant, you can start talking about Count the Kicks. That would be really, really helpful. Again, including in a family care or intake form, and documentation is your friend. If you're a nurse on here, that glucose test, here in Iowa, we have to actually drink that wonderful liquid and then do it all within the clinic. And then we have to wait there for an hour, get our labs drawn. So that's a perfect time to take the drink, take the blood work, and have the nurse say, hey, go ahead and read this brochure and download the app, and we'll talk about it when you come back for your 10-minute check. So that's another good opportunity. And then we love everything electronic. So your EMR, your EHRs, could you add a question to your Epic or electronic medical record or a system that you use that pops up in the third trimester to remind you to ask about fetal movements? I've worked with WIC clinics here in Iowa that have electronic systems where they have implemented touch points within there to set reminders to say, talk about Count the Kicks. We're all busy. We're busy in our personal lives and we're busy in our professional lives. So any way we can make this easier for you all to remember is important to us. And then this is an example of our, what we would call our gold standard discharge papers or after visit summary papers. So this is if you're working in a clinical setting or you're working in labor and delivery, mom comes in, gets checked out, everything's fine, she's going home. This should be her on her discharge papers if she's in her third trimester. So we worked with Mary Greeley Medical Center to draft this up. You can see where the arrows pointed. If this is something that you'd like to start integrating more, let us know, contact us after the presentation, and we can help you with this verbiage. That is what we're here for. We're here to make this as easy as possible for you. And then this is just a form that we created when you think back to that form I just talked about for like the front desk or something that we can tweak slightly for you to hand to your expectant parents. Maybe they have to fill out some paperwork. Maybe you know that they're pregnant and you know they're even close to the third trimester. Maybe they're 24 weeks, 25 weeks. That would also be a totally fine conversation to start talking about this and say, when you come back, when you're in your third trimester, we'll talk about how the app is going and things like that. So this is something we created more for a clinic setting that we ask the front desk staff to hand out, or even the nurse, as she's taking the expectant parent back to the patient room. They can just fill it out. It doesn't take long at all. And then they can detach the other side there that you see where it gives them more information about downloading the app. And then we added a section about the doctor name, the phone number, the address, the labor and delivery hospital, so that they could always have that in their purse or on their fridge. And then this is just another form. This is a community-based organization in Ohio that they see expectant parents one time, and they're continually seeing new people. And so they had basically one shot to connect with expectant parents. And so what they wanted to do is on the form that they had everybody fill out, and they serve around 2,000 pregnant women a year. They wanted this section about Count the Kicks. And then they added a little bit of a script to talk about it with the people that are filling this out. So again, we help them with this language. We're happy to do that with you in any forms that you want. So I know we're going to get close to our time, so I'm going to try and speed up a little bit, but This is one of the key things I wanted to talk to you about today. So along with this great partnership with the Children's Trust of South Carolina, you all, if you are a MCV home visitor, you should have received, or somebody on your team should have received, a toolkit. A Count the Kicks toolkit would have come in a white box, looked like exactly what you see on the screen. And within this toolkit had a couple pieces that I really want to highlight for you. You would have received these kick counting bands that you see there. They have the numbers 1 through 10 on it and a slider. So this would be a great piece for somebody that doesn't have a smartphone to count and use the app, or has Wi-Fi and broadband issues, or maybe they just like the old school way, right? They like that pen and paper. We have a paper chart on our website. Whatever they want to do with it, however they want to use it, maybe they just want to wear it for a reminder. This is for you to use with your expectant parents. Along with that, you would have gotten a piece of kind of like a postcard size that you could hand out with the bands when you hand them out. So the expectant parent knows exactly how to use this and why. You also received some low literacy educational materials. So you can see the brochure right there. This is a great piece. You have brochures in English and Spanish and posters. If you work with a lot of individuals that maybe are, refugees, English is not their first language. These are very picture heavy, less text, just good pieces that really share about Count the Kicks and how to use the app without just inundating somebody with a bunch of words. So again, this all should have came to you in the survey that Jen is going to send with the email. There'll be a question to see if you are a MCV home visitor, if you received this or not. And if you didn't receive it, let us know. And if you did receive it, but you'd like more materials, you can let us know that too. So we'll be connecting with you on that. But this is a great tool. We're super excited to get these out. We hope that you are going to find them useful. We'll be doing a quick evaluation with you in a couple months to see what your thoughts were, what you liked, what you didn't like, what you'd like to see potentially in the future, and just how it's going. So with that, we'll keep moving along. So we really want to stress the importance of knowing when you're talking to expectant parents, to know their baby's normal. Again, we say that because that's really the big takeaway here. Understanding what their baby's normal is and speak up. Make sure the people that you're working with know the number to call if they have a concern. Make sure they know that they can call, they can go into the hospital, that is their right. And that's what the providers are there for. They want to hear from them if they have a question, whether it's this or bleeding or whatever it is, contractions, their provider is there for them, and hospitals are open 24/7. So really stress that with your expectant parents. Sending the brochure home with them. Always have a bundle of brochures in your car if you're out and about in the community a lot. You guys are our boots on the ground. We're located in Iowa and we're a national organization because of these great partnerships like this. You are the ones that are sharing this with your families and potentially saving lives. Sharing with your expectant parents that research shows evening is usually the best time to count, but I don't get too hung up on that. We know people work a lot of different hours. Just really stress to them that you want them to count around the same time every day when baby's normally more active. So let's say maybe that's 2 o'clock in the afternoon, or maybe that's 8 o'clock in the morning. Whatever it is, make sure they do that around the same time, because that's really what's going to give them that pattern, that trend to see what their baby's normal is. And then tell your moms that your provider should be talking to them about Count the Kicks in every appointment in the 3rd trimester. So really quickly, we're going to go over some additional resources.
Thanks, Megan. Yes, let's talk about our educational materials. We've referenced them about posters and brochures. What do we have? We have a couple styles of posters, a promo poster and the how-to poster, which is shown on your screen. And those are both in English and Spanish. We have business card size app reminder cards that are just a nice way to make contact with the mom and send that reminder home with her. These are free thanks to the partnership with the Children's Trust for those low literacy ones, and the South Carolina Department of Health and Environmental Control for the rest of the materials. And they are on our website, www.counttthekicks.org. Put these posters in your clinics and your bathrooms, if you're in that setting. If you're in a different setting, is there a good place to display? If not, use the brochures and the app cards as your mobile tools, so to speak, that can travel with you. Put them in the clinic setting in multiple places, both in the waiting room and in the patient room. These are great reminders for mom and for you, and educational resources. Again, free to you to order what you want. In fact, Megan and I will be watching to see.
I was just going to say that.
One of the things that really is rewarding is to see that these free materials that are, just a resource free to you, are being ordered and utilized. We encourage you to give them a try, implement this system, so that it's just it makes your job even easier, and it makes that conversation with mom top of mind. The other resource that's in your state, we have 2 amazing ambassadors in South Carolina, and I'm going to talk about them in a second. And what does that mean? And I said in the beginning that I work with the ambassador team. We have these women who are volunteers that are passionate advocates due to their own personal experiences. What does that mean? For many of these women, 33 of them, of the 42 in our program, come to us as moms that have lost babies. And many times I hear from them that they just wish somebody would have educated them, that they did notice a change in movement, but didn't know what to do with that, or that it was even important. Or they felt like they would bother someone. They didn't want to be that worried mom. And so they kind of kept that worry to themselves a little too long. And they have huge regret, and some of them carry huge guilt. And so we don't want moms to be put in that situation. That's why it's important to educate. And the other thing that Megan mentioned that I think cannot go without being said again is women need to hear from you that you want to hear from them. How to do that? Give them your phone number for the clinic, or what should they do if they notice a change? Giving them permission to speak up is a really important tool in getting them to do that, and do it more quickly, and taking away that anxiety they may have if they do have a concern. And ambassadors do a variety of things, including giving presentations with us like this. They also fundraise and give interviews, advocate for legislation, go to baby fairs and medical conferences. They are such important, again, that boots on the ground. We are a small nonprofit located in the center of Iowa, but we're a national nonprofit because of people like you and that are spreading the message, but because of women like these that advocate for us. I'm not going to show, for the interest of time, this is Danielle Barkley, who actually just gave birth last Friday to a baby boy. I'm not going to show the video just for interest of time, but I am going to go to the next slide here and show you Emily McConnell and Danielle's picture. They actually, every year in the greater Charleston area, they both live in Somerville, they host a walk of remembrance. And I think it's really important that acknowledging babies gone too soon. And then they also do a massive amount of raising awareness about Count the Kicks and raising funds for Count the Kicks. And that is such a great event in that area. It has been virtual the last 2 years, but I think they're excited in year 4 to see that go back to an in-person event and an opportunity to recognize babies gone too soon, and also to educate. Why are we here today, folks? We're here today to make sure that babies get here safely. We have many, many baby safe stories, well over 80 that we know of, and so many more, because people have to come to us organically and share those stories. And we oftentimes, more than not, do not hear the stories, but the ones that we do hear are extremely powerful. And here are some of those sweet faces. And to get you excited about the work you're doing, how just telling one mom, the mom that needs that information, literally, you can be a part of saving a baby's life, just like our ambassador Danielle was. She's sitting in a ballpark. She's made friends, with the parents on the team of her little boy, and a friend is pregnant. She shares about Count the Kicks. And lo and behold, that mom, Catherine, was one of the women that needed to know and understand how to count her kicks and use that information. And she did. When she noticed a change in movement just shy of 38 weeks, she did the right thing. She notified her doctor, who took, again, the right steps, took her concerns seriously, perform the necessary test, and it was determined that baby would be safer arriving a couple of weeks early rather than staying with mom. And so mom was induced, and sweet Olivia that you see here arrived safely. She's now a very active 2-year-old. And you can see this beautiful quote from Catherine that says, "My doctor explained that the cord was around her neck, was likely why her movement decreased, and was just as relieved as we were to have her here healthy. I will never be able to express my gratitude to Count the Kicks for teaching me about the importance of truly listening to my baby and my body." And that's Catherine. Next steps, Megan.
Yeah, so thanks so much. We know we went a little bit over, but it's just so much great information to share. So like Jen said, here are your next steps. Download the app, please, please, please practice. We want you to be able to pull the phone out and say, look how easy this is. Let's do this together. Make sure your entire team knows about this. Order it. Like we said, we love doing these webinars, and then we get these emails saying so-and-so ordered. It just makes us feel so great to know that this is happening in South Carolina. We also have an online CE training. It's 90 minutes, and we'll put this all in clickable links in your email that will go out, but you can use the code SAVEBABIES-SC to access the training for free. And so again, we just want to thank you all for being here today. You can connect with us we have all the social media channels. Sign up for our newsletter. Our contact information is on the screen there. We will stay on to answer any questions you may have for a couple minutes. Feel free to put them in the chat box because you're automatically muted. But yeah, we just thank you to the Children's Trust of South Carolina for allowing us to present to all you wonderful people and organizations today. We're just truly, truly grateful and so excited to save babies with you in the great state of South Carolina. Yes, I forgot I was going to turn my camera back on. So thank you. Thanks, Annette. Yeah, you're welcome to stay on and ask any questions in the chat box, and I think we can unmute you, or you can sign off. And like I said, this is being recorded. So Jen will send out an email either later today or tomorrow, probably, with all of this great information. So, oh, awesome. Thanks, Kristen. Thank you all. You all are so nice. I hope you're all having better weather than we are, especially in, what was that town, Jen?
It's
Surfside.
Surfside Beach.
Yeah, I'm gonna Google it now, see if I can get a verbo there or something sometime. Thanks, everybody. Wait just a minute, see if anybody's gonna ask questions. Thanks, Natasha. All right, I don't see any coming in, but our contact information is there, Jen. So if you want to go ahead and end it, and we'll see you all later. Thank you so much. Bye.